Hi, everyone. It's been a good week, all in all. Great sort of expectations coming our way. Perhaps May, we're all going to go on holiday. Who knows? But it's looking a heck of a lot better than it was a week ago, and certainly a heck of a lot better than it was 2 weeks ago. So we're on some sort of roll. We don't want to get ahead of it. We've got to be really, really careful and continue to be careful for the next weeks until everybody's had this vaccination, until the numbers actually come down, because they are still massively high. And we're very, very conscious of the vulnerabilities of the individuals that we're supporting. And we're also very conscious of the fact that we've been so far very badly let down in getting vaccinations for the Bardney site and also for the Fiskerton site, which is obviously the Old Hall, and in Bardney is the hawthorns, brambles, hollies, oaks, etc. And we have been really badly let down because there are a number of individuals in there who are classified as being sort of very vulnerable and at high risk health-wise, and should be in category 4, and category 4 should now be really being rolled out. I do not understand how anybody could have said that some of the individuals that we support are at less risk than an 85-year-old elderly person who is in good health. So I think it's ridiculous that they've been cut out of that sort of immediate first wave. I think it really is. I think it's just discrimination. We were on Channel 4 this week where we've been really trying to push this. We're trying to pressurize as much as we can, but it does come down to the fact that there is a very, very poor understanding about individuals with learning disabilities, and there is actually discrimination against them through that lack of understanding. And it's not because people are bad people. It's simply they do not understand the complexities of some of our sons and daughters, and the fact that they are in social care, as opposed in the past perhaps to being in nursing care and those type of environments, they don't get it, which is disappointing after all of this time, and especially as Public Health England themselves brought out the report which Professor Giles Glover authored back in November, which said if you are a certain category of vulnerable individuals within the, I think it's 18 to 34 age group, you have a 30 times higher percentage of possibility of dying. So they know all of this stuff. So we are being massively, massively cautious. And equally, we are putting as much pressure, reasonable pressure as we can on staff to get vaccinated, because obviously there are risks to all of these individuals. So far we have 290 of our staff have either been vaccinated or booked in, which is fantastic. If you then deduct those members of staff who can't be vaccinated because of maternity or for other well-regarded medical reasons, that only leaves 47 staff who either have not responded or may be quivering and saying, oh, well, my best friend just told me that I shouldn't have a vaccination, because, you know, you just really think, well, that isn't your best friend or even your friend if people are saying these things, because it's in everybody's interest to get vaccinated unless you have a predisposition towards some medical situation. I know that there are a number of care providers who are now actively considering making it a condition of working in social care, because there will always be a number of individuals that we support who cannot be vaccinated. So anybody who's working with them who has not been vaccinated is a risk to them. So I think this is going to play out over the next weeks and months, and I think that you will find that there will be people who will be precluded from actually being able to work in certainly large elements or certain specific elements of social care, because risk assessments will say this is too high a risk. Equally, there are going to be a lot of people who aren't going to be able to go on holiday, because what does seem pretty logical is that there are going to be these passports, vaccination passports being introduced. It will happen. I'm totally convinced of it. But anyway, we are well over 80% of our staff having been vaccinated or agreed to be vaccinated, which is really great. And we are really pushing very hard for these individuals that we support who have not been vaccinated, which, as I say, is very disappointing. But, you know, this is the way it goes. We've done 517 tests in the last 7 days. So we're maintaining all of that. We've got, I think it's 12 staff off at the moment, COVID related, which so the figure's fairly sort of constant, sort of around 10, 12, 13, 14 staff every week. So that's not getting worse. Of course, what it does show is that staff who've been off for 14 days are coming back, and then other staff are going on. So that again is giving us a fairly good indication that COVID is very much out there. And certainly we had a confirmed member of staff, staff member being confirmed having COVID. I think it was today or yesterday. So it's there. This is very, very real and apparent risk. So anyway, hopefully this positive, if still frustrating situation will continue in this way. As long as it stays positive, we've all got something to look forward to. I need something to look forward to. I'm sure all of you do as well. So look, on that positive note, I'd like to wish you a great weekend and a fantastic week for next week, and look forward to catching up with you then. All the very best.